Hey, thank you for having us. We would like to know your reason for starting in the first place with clear aligners and for what different purposes you use aligner treatments in your practice today. Can you please first introduce yourself?
Sure. My name is Mustafa Omar. I'm a dentist. I'm a general dentist, but also an implantologist. I've been doing this for almost 17 years. So that's a short introduction of myself.
Thank you. Why did you start treating with clear aligners in first place?
I think as a dentist, it's of course nice to always broaden your horizon and modernize your not only your clinic but also your treatment. So my reason for that was to go along with the developments in the dental field, and clear aligners were one of those chapters of the dentistry that I was interested in.
Okay, thank you. Are you noticing an increase in the demand for clear aligners in your practice?
Absolutely, absolutely. Of course, it depends on the way you promote the treatments. But first, when we started, we were a bit hesitant whether we will have enough demand for that. But in a couple of months, I could say there was a huge increase in demand, and people were interested in it. So yeah, we definitely realized a huge demand and increase in it.
Okay, and what indications do you see for clear aligners in your practice?
Well, mostly what we apply is aesthetic corrections like front malalignments, relapses sometimes, diastema, a lot of spaces that can be adjusted. Sometimes we do that in combination with implant treatments. So, any indication that's you can think of within the orthodontics, you can use the aligners for.
Okay, thank you. Can you still think these treatments away from your practice nowadays?
Well, to be honest, I would not think so. I would always consider taking aligners or advising aligners for my patients to take in a combination of other treatments as well. So no, I think it's a integral part of my clinic right now.
Okay, and what would you recommend to your colleagues who are not working yet with aligners?
Well, I would say just try and have a dive in the deep. So, of course, it can be scary, especially when you have not started yet. But I think with the time, with experience, of course, you'll be fine with it. So give it a go. Do it.
Was there a high threshold as a dental practice to get started with clear aligners?
I think it's individually different. In my case, it wasn't that difficult, or the threshold wasn't that high. But I think some of my colleagues might feel the threshold to be high. I don't think it's a problem. It's just a matter of dating and because it's not something you haven't done before. I mean, you know what aligning the teeth are. It's just a different method. So it shouldn't be a high of a barrier. So you just try it. You'll be fine.
Okay, and what do you think of the service we provide you with as TrioClear?
Well, of course, I'm happy and satisfied. Otherwise, I would have stopped working with you guys. So sometimes when there's any difficulties, we have direct contact, and the lines are really, I mean, the contact lines are really short. We can email, we can call, we can whatever. Of course, the means of communications are there. So yes, we are happy with the service. Thank you.
Okay, thank you.